Girl, I cannot believe that you're going on a date straight from work. Especially after today, those kids were just crazy. I can't even imagine being flirty and social right now.
It's not like it's our first date, plus it's a pick-me-up.
If you say so.
You learn how to have fun. I don't feel so good.
Girl, I don't think you're going on a date.
911, what's your emergency?
Yes, I think my friend is having a stroke. Can you please send someone now, please?
All right, my name is Dr. DeWick. I looked over your scans and it shows that you have an ischemic stroke, which means that part of the circulation to your brain is being cut off. Does that make sense? All right, and that's what's causing all of this. There is a drug called Alteplase that will be able to break up that clot for you, but I have a few questions to make sure you're a candidate first, okay? First, when did this all start?
About 5 o'clock.
About 5 o'clock? All right, looks like you're still in that 4 hour window. We have to administer it within 4 hours, otherwise it's not as effective. Have you had any NSAIDs or anticoagulants like warfarin or aspirin?
No.
No? Perfect. If you had taken that along with any herbal supplements or food like ginkgo or garlic?
Mm-hmm.
All right, if you had taken any of those, it could lead to excessive bleeding, which we don't want. All right. I'll go ahead and put in that order, and the nurse practitioner will come in to administer it and answer any questions you have, okay?
Oh, thank you, doctor.
You're welcome. Yeah.
Hello, Mrs. Rodriguez. How are you?
Okay.
Good. My name's Julie. I'm the nurse practitioner here, and I'm going to be administering the Alteplase today, okay? Okay, so the doctors ordered this. This medication is used to break up the clot to prevent any worsening symptoms and side effects, okay, from the stroke.
Okay.
Okay, so some common side effects that you might notice is itchiness, rash, bruising. You also might get dizzy, so if you're getting up, make sure you're getting up slowly to avoid any fall, and we can also help you if you need help as well. If you use a toothbrush, make sure that you're using a soft bristled toothbrush to avoid any bleeding. If you do notice any excess bleeding, say from your urine, your stool, your nose, or your mouth, please let us know immediately because that's an adverse effect, and we'll need to get that taken care of immediately, okay?
Okay.
Also, if you feel like your heart is palpating out of your chest, anything severe, please also notify us because that's an adverse effect, okay?
Oh,
Do you have any questions for me?
No, I think I understand. The medication going to take away the clot in my brain, and I'll stop talking like a 2-year-old.
Yes, okay. So I'm just going to take a look at the vitals over here, and your heart rate looks good. So I'm going to look here at your IV side, it looks good. I've already verified everything, so I'm going to go ahead and administer this medication, okay? All right. Hi, you ready to go home?
I'm so ready to go home.
How are you feeling?
I feel so much better. Thank you so much.
Good. So I have your discharge paperwork here. Do you have any questions for me?
No question.
No? Okay, if you have any questions that come up before you leave, I'll be happy to answer them for you.
Okay.
You can go ahead and read through these, and hopefully we won't see you soon.
All right, thank
Goodbye.
you. All right, bye.
Girl, it's been such a roller coaster for you. I feel so bad for you.
I know. I'm just happy to be out of the hospital. Honestly, Alteplase saved my life, and you saved my life. If it wasn't for you, who knows the damage it could have been caused.
Oh, so sweet. I mean, that's what friends are for. But I'm so glad that it was from a clot and not a hemorrhage.
Right.
And I'm glad they were able to give you Alteplase.
Mm-hmm.
But how are you feeling now?
I don't feel so good. I'm just joking. I'm just joking. I feel great. You gotta admit that was funny though.
Girls, don't play with me
Alteplase, which is known as a clot buster, is given for ischemic strokes, pulmonary embolisms, acute myocardial infarctions, and occluded central line catheters within 4 hours from start of symptoms. Brands include Actilyce, Activase, and Cathflow Activase. Bleeding is a common side effect, so be sure to report any excessive bruising, blood in urine, and nosebleeds. Other side effects include rash, and nausea. Immediately report any chest pain, difficulty urinating, or shortness of breath because these could indicate life-threatening adverse effects like pulmonary edema, dysrhythmias, or renal failure. Refuse Alteplase if any of the following apply to you: history of aneurysms, history of any cerebrovascular accident or brain attack, history of a brain tumor, injury, trauma, or surgery within the last 2 months to the head or spine, and low blood platelet count.